I'm Chris Hardwick. I'm a gynaecologist in the NHS in Glasgow and at BMI Ross Hall Hospital. I've been an NHS consultant since 2004 and I've been at Ross Hall I think since about 2010. As a gynaecologist I see a wide range of conditions and I think they're probably divided into three broad groups. I see women who complain of pelvic pain, so that would typically be endometriosis or ovarian cysts. Investigate them, usually with ultrasound scanning, and operate as necessary, either to remove endometriosis or to remove ovarian cysts. Usually is keyhole surgery. Keyhole surgery more recently, techniques of this have allowed us to remove quite big cysts or quite big areas of endometriosis, while still allowing women to usually go home the next day following surgery and avoid the risks of a large incision on the abdomen. When it comes to heavy periods, women with heavy periods often come for investigation. So that would typically be investigation to make sure there's no problems inside the womb, and typically be ultrasound scanning as well, which I can perform either in clinic or in X-ray. I have a weekly ultrasound scan list in the X-ray department where I see women who've been referred either by their general practitioner or by colleagues here for ultrasound scanning. And women often want treatment for their heavy periods, and I can perform various treatment for heavy periods up to and including laparoscopic hysterectomy. And again, I think modern laparoscopic techniques can allow us to remove quite big fibroids or quite enlarged uteruses while still allowing women to go home shortly after surgery, typically the next day. I also see women who have prolapse and incontinence problems, and again perform laparoscopic or vaginal surgery for prolapses, which is quite a busy part of the workload these days actually. So a typical patient pathway would be coming along for an initial appointment so we can find out what the problem is and how bad it is. Investigation is necessary, so that might mean an ultrasound scan in the clinic or an ultrasound scan in the X-ray department in one of the specialist vaginal scan lists. Operations, if needed, are generally booked a little bit in advance, and then follow-up appointments would typically be 3 weeks or so afterwards. So the going from initial diagnosis to completion of treatment doesn't take very long if you're coming to Ross Hall Hospital.